The following guests were doctors before they were members of Congress. Louisiana Republican Congressman Charles Bustany and Tennessee Republican Phil Rowe. Also, Dr. Mark Siegel is part of our Fox News Medical A team. And gentlemen, good morning to all three of you.
Good morning.
To the members of Congress first, this is what Jay Carney said last night. Last week, the Affordable Care Act will deliver on its promise to make health insurance more affordable and accessible for Americans. So the congressman from Louisiana, is he right?
Well, Bill, I have to say that we're already seeing hikes in premiums, and my concern is that the way this is structured with the exchanges, you're looking at a restricted type of exchange, limiting choice, but also running up premiums because of the types of benefit packages that are being offered in this. And so I think costs are going to go up for almost everybody. I do believe we're going to see some restriction in choice in the exchanges. And then finally, these exchanges are not ready for prime time.
To Congressman Rowe, excuse me, do you agree with that?
I do, and Bill, we've seen this 20 years ago in Tennessee when we rolled out our health care reform called TennCare, and it wasn't ready for prime time. And what unfortunately is going to happen tomorrow is there's going to be a lot of unfulfilled promises, a lot of things that don't happen on time. Now, let me just say this. The premise of lowering cost and increasing access, I think both Dr. Bustany and myself agree with that. Will this actually do that? And the answer is no. I got an email from a friend of mine in North Carolina whose premiums are going from $200 and something a month to $500 and something a month. And why is this? We didn't do a very good job of explaining about pre-existing condition and the uninsured, I think, during the health care debate. For those that have private health insurance now, this really doesn't affect you much. For you there at Fox News or people working at Eastman Chemical in my district, won't affect
unless
you
your
much.
company drops your coverage, and we've seen that
unless
already,
your company drops your coverage.
Right. Now, listen, there was a law that was, there was a bill that was passed by the House late on Saturday night on the screen for our viewers here. 1 year delay of the law, repealed the medical device tax, it's 2.3%, and also the birth control mandate opt-out. I don't know, Congressman Bustany, if that's, you know, you're up against the clock right now, and it does not appear that you will be granted those measures passed late on Saturday night. But what both of you gentlemen are explaining to us now is the fault in the law, and if it is the case over the next year and beyond, Americans will see that. And if they do see the fault in the law, what is the ultimate effect of that?
Well, Bill, one of the things I'm concerned about is the requirement in these exchanges for data to be shared amongst agencies, both at the federal, state level, insurance companies. We're very concerned about the integrity of this data, first off. And secondly, I don't know of any instance where government agencies have been able to cooperate and coordinate their efforts very well. We know that the IRS is in the mix of this. I'm the chairman of the subcommittee on oversight on Ways and Means. We're looking at the IRS. We know there are major problems there. I have really deep concerns about where this is going.
Okay, I want to bring in the arbiter of all this now. Mark Siegel, you've been sitting there listening. Are they right or not, and on which point?
Bill, the first thing I want to say is, and they're too humble to tell you this, Dr. Bustany and Dr. Rowe, congressmen, have been in practice together more than 60 years, myself more than 20 years. We're talking 80 years of clinical experience. We're the people that they should have gone to begin with when they started figuring out how to give more access to patients and how to give access to patients that don't have it. And what they're saying is premiums are going to go up and access is going to go down. Now, another reason access is going to go down, and I agree with both of them, is that the kind of insurance that's being offered on the state exchanges has very limited options. The networks are shrinking. You won't be able to get to the doctors or the hospitals that you may want. That's a serious problem. So while you're struggling to figure out if you can pay for the premium, while you're waiting for some government subsidy or entitlement, on top of that, you may not be able to get the care you used to.
Now, these gentlemen I'm hearing from all three of you that this is a bad law. Now Siegel, I mean, are people going to come around to that? I mean, do you stand by that now? Or are these just, as the president say, hiccups and bumps along the road that will be smoothed out in time?
I think that people already know this, Bill. You say people coming around to it. Poll after poll have shown that Americans are not happy with this law. And in the doctor's office is where they figure it out. They go to the doctor's office, they're going to find a doctor like one of us saying this law isn't working for me. I'm not getting paid enough. I have too much paperwork. I can't afford to take care of you anymore. All of that has been happening because the kind of insurance we're talking about started in the 1990s. It's just being extended.
Okay, I
all
can
the
understand
bad
that.
things.
Okay, now the Congressman Rowe, you get the last word on this. As you look at, okay, go ahead.
Let me personalize this for you, Bill. In my own hometown, my personal doctor quit. And he quit why? He and his partner quit. He's a urologist. And 40% of our urologists in our hometown quit and retired because of all of the complications, electronic health record, all of the issues that they have to do to deal with this. And you see this, as Dr. Siegel said, there's no question in my mind that access is going to go down. We've lost jobs. We've had a hospital close in Southwest Virginia. A major medical center in Tennessee is laying off 1,000 people. That's never happened, 1,000 healthcare workers. Great jobs. So it is a train wreck, and we need to pause this for a year and let us work out some of the details so that we can better implement this.
Okay, gentlemen, thanks to all of you. Phil Rowe, Charles Bastani, and Mark Siegel.
Thank you.
Really appreciate your input, man. Thanks,
Bill.